Hello everyone, welcome to session 6 of CAHA's annual Greening the Healthcare Sector Forum. I'm delighted to be facilitating this session, Where Are They Now? Stories of Progress, where we're going to hear from previous presenters at these forums. So my name is Sarah Joyce. I'm joining you today from the lands of the Whadjuk people in Noongar country, Perth in Western Australia. And I would like to take a moment to acknowledge the traditional custodians of the lands from which we're all dialing in today, across Australia, New Zealand, and potentially some overseas participants as well, and pay my respects to their cultures and their elders, past and present. We recognise their profound connection to country and their stewardship over thousands of years to protect our lands and waterways. We also respect their enduring knowledge and wisdom of health practices and medical treatments that lie outside Western medicine and which they have passed down through the generations. Before we begin, I would just like to give a special shout out as well to Bupa Australia. They're our platinum sponsor for this year's Greening the Healthcare Sector Forum, and their support has really enabled us to bring this virtual event to life. So I do encourage you to visit them in the exhibition hall if you haven't already, where they'll have representatives who can answer any questions that you might have. So just a few housekeeping notes before we begin. So at the bottom of your screen, you will notice that we have a discussion forum, and we do encourage you to share your reflections and thoughts throughout the session with other attendees through this. Q&A, we'll be having a Q&A session at the end after all the presentations. But please feel free to post your questions as you go so you don't forget them, and we'll come back towards those at the end of the session. And finally, just a reminder that this session is being recorded and will be available later via this platform for about 4 months post this event. And finally, as always, we'd love to hear your thoughts and reflections on today's session. So we do encourage you to please tag us at healthy_climate on Twitter or the Climate and Health Alliance on LinkedIn. Okay, so the final session for this year's forum is a little bit different. It's really an opportunity, I think, for us all to reflect on the progress that we've made in our shared commitment to sustainability and healthcare. And we know that this can be a challenging space to work in because there is still so much to do. But it's really important to stop and acknowledge, I think, the achievements and the successes that we've had and, try and use those as inspiration going forward. So we're fortunate today to be joined by several past presenters who will give us an update on their passion projects. And these range from, approaches to embedding sustainability into business as usual, integrating green space and Indigenous gardens into hospital facilities, and addressing waste and plastics on our wards. And when I saw the program being released, I did actually remember hearing from all 4 of our previous speakers at other events. So I'm really looking forward to hearing what they're doing now and the lessons they've learned about maintaining momentum and keeping that metaphorical fire burning. So it's my pleasure to introduce our first presenter. Dr. Ramsey Awad is currently the Executive Director of Infrastructure, Planning and Sustainability for Hunter New England Health, which is one of Australia's largest health services. It covers the geographical area of the UK and has over 80 facilities. The infrastructure and planning portfolio is responsible for clinical planning and delivery, capital works, engineering and maintenance, biomedical engineering and sustainability. And Dr. Awad's qualifications include a PhD in health and medicine, bachelor degrees in architecture and construction management, and executive training from the Harvard and Cambridge Business Schools. So over to you, Dr. Awad.
What a lovely introduction. Thank you so much, Sarah. We are keeping the fires burning, but they are emission-free fires here in Hunter, New England. And it is really my pleasure and our pleasure, because I know the team is listening as well, to share where we're up to with our journey, which started, we're in our 4th year now, and I'm going to be sharing with you some of our 3rd year results, and we're in the process now of compiling our 4th year report card. And just at the outset, just want to say how much we appreciate the Greening Healthcare Forum and what the organisation does, and these sessions which bring like-minded people together. It's a real blessing to have that as part of our environment that we operate in. So thank you very much. Now I'm going to get into it and share with you some slides. Sarah gave us a great acknowledgement of country, and I can't top that. It was lovely. But also just want to acknowledge I'm on Awabakal land today and pay my respects to elders past, present and emerging. So for those of you who didn't see my previous presentation, just to give you a sense of Hunter, New England, there's a little map there which shows our geography. Right down the bottom here is Newcastle, which many people are familiar with. It's about 2 hours drive north of Sydney. And our area spans all the way up to the Queensland border. We're about the size of England. We're the largest health service in New South Wales. We cover a major metropolitan area, which is the Newcastle area, and an enormous rural area up into areas like Tamworth and Armidale. We're the largest employer in the region, about 20,000 employees, and our budget's about $3 billion. And sadly, we hold the title of the busiest emergency department in the state and the second busiest in the country. So just to remind everyone what we started off trying to achieve 3 years ago, and there were 3 parts to our vision. First is being carbon and waste neutral by 2030. That's the headline. Second, and importantly, to ensure that that we never forget that delivering healthcare is our core business in health, and we deliberately did that because it's even more relevant in the last 12 to 24 months, where if you are working in government, know that money has constrained dramatically. That we never wanted to create that tension where people were making decisions regarding solar panels versus employing a frontline clinician. And we've deliberately adopted an approach which prioritises our frontline clinicians, and we've deliberately adopted an approach where all of our sustainability initiatives, most of them save money that we can redirect into frontline clinical services. So that tension is taken out, and everyone's happy. It's a win-win for everyone. Finally, being the largest employer and the largest health service, we have the opportunity to lead the market and drive change in that space. So that's what we started off trying to do, and I feel like we're a good way along that journey. We had some goals, which I'll allow you to read as they pop up. A couple of important ones I'll highlight is adopting some Aboriginal stewardship values around caring for country, and we worked with the University of Newcastle on making sure that that wasn't tokenistic. We've actually developed a guide around all of that. And another important one is engaging and empowering our staff. We know that a lot of the shift in the needle in terms of emissions is some top-down stuff around solar, around LEDs, around energy usage. But this is a big change program, and we really need our staff and our community to drive the journey and go home and proudly talk about it with their loved ones and their friends and others about what they're doing in the sustainability sense in their organisation. So I'm going to jump to our targets and our 3-year report card. We have some emission targets. So the first is CO2. You can see that our baseline year when we started was about 100,000 tonnes. We wanted a 30% decrease in our 3rd year, and we just surpassed that target at 31%. Now that's impressive, I admit, but it's going to get harder and harder and harder each year. It's going to get harder for a couple of reasons. One is we're probably adding more buildings at the moment. There's new stock, new hospitals being built in our region. So we're going to have to look at our baseline and how that adjusts. But also the big simple things you can do around solar and LED can only get you so far. And really the challenge in our thinking now is what do we do next to help drive this to zero? And I'm happy to take some questions about some of that and steal some ideas. A big thing for us is rainwater and water usage. A big part of our district is in drought. Again, it's gone back into drought. we wanted to have all the water that lands on a roof captured and reused. We were only doing that in the 5% of cases across our district. Our target was 30%. We were nearly at our 4-year target, which is 39% in terms of, and that's really rainwater tanks on all our facilities. The next is water recycled and reused. We're always going to need some level of water in health, but we've put a number of initiatives in place, which I'll touch on in the presentation, to increase that figure, and we're just shy of our target at 28% for this 3rd year. And then finally, the element which is hardest and most challenging is waste going to landfill. I kind of feel when I put this one up, we should have just stuck with CO2 emissions, but we were being daring at the start. Now, 92% in our baseline year went to landfill. That figure's at 24%. The team tells me that that figure may be a bit soft, only because our reporting in this space, because we rely on a third party, is a bit difficult, and we're doing some work in that space. But we're getting there and we're moving towards the target, we want to try to achieve. I'm going to just touch on our 6 focus areas and tell you what we're doing in each one of those spaces very quickly by way of strategies. So in terms of energy, it's very simple. Solar panels on every roof, LED lights in every building. We're now looking at, when I talk about what's next, we're looking at our sites where we've got lots of land at ground-mounted solar, and the idea of introducing batteries in some of those smaller facilities that can return energy to the grid. In terms of our progress in that space, out of the 59 campuses we're working on, we've got 40 of those in place, and this is some of our reporting, which shows not only how we are progressing, but the systems we're putting in, how much money we're saving each year, and how many kilowatts we're saving each year with each of those systems. In terms of LED lighting, we've done some maths on this. If anyone hasn't done LED lighting, it is a no-brainer. You pay back any money you put in place in less than a year and a half, and the recurrent funding savings are about $1 million a year just in our facilities. So again, a very simple thing for anyone to do. In terms of water, we've got tanks everywhere. As I said, we're looking at low flow fixtures now across our hospitals. We're looking at leak detection across all our campuses. And one of our big early strategies was capturing clean water from renal dialysis services and reusing that to flush all our toilets. They're our current water strategies. And in terms of all those strategies, and in terms of water tanks, we are 26 out of 56 sites in place, with a plan to complete the rest of that in the next 12 months. These are some of the new areas we're playing in. Transport, the obvious of moving our fleet vehicles to electric, hybrid electric, but we've put a lot of energy in the last 12 months into EV infrastructure, particularly in our rural areas and regional areas. We have recharging stations in major centres like Newcastle, but the further you get out, the less it exists. So we have just installing a whole raft of charging stations in our regional areas. The other thing we've done too is staff, some of our clinical staff are trading in their fleet vehicles where they attend meetings and look and visit patients at home for e-bikes. So they're riding on e-bikes to deliver that care. And I'll share with you some of the work we've done in that space, because I think it's first in country that's done that. And also first in the country, we've introduced for our staff the ability for them to salary sacrifice to buy e-bikes to ride to work. This is some of, I just saw this yesterday for the first time the team has pulled together. These are the number of trips so far since we've introduced e-bikes only several weeks ago for our staff, and where they've ridden to between campuses and the like, and some school visits you can see there, instead of getting in a vehicle, which I think is a great initiative. Infrastructure strategies, I won't dwell on this. We've got a 5 Green Star rating target for all of our facilities. We've got about a $2.5 billion worth of infrastructure on the go at the moment. We've spent a lot of time. There's a picture of Alana, one of our sustainability team members there, working with a lot of our Aboriginal communities around collecting seeds, around replanting, around where we do take down trees for projects to reuse and repurpose that timber in signage, in furniture, in arts and crafts. That's building a lot of momentum in our community. Waste is, I think, the most exciting space that we're entering into. We've done the basics, which is introducing waste streams, and we've got general recycling, organics, and then some sub-streams within that. Rolling that out in a health environment is difficult, mainly because a lot of our older facilities don't have waste rooms that can hold multiple bins, but equally getting our staff, mainly our clinical staff, to put stuff in the right bins is also a challenge. And thirdly, in our loading docks, having the space in loading docks. And I guess there's a fourth issue: does the local council, can they manage the type of waste we've got? And again, the further we get out from our larger centres, the less we're able to recycle. But this is our progress, and we are trying to reduce our general waste and increase our recycling figures here, and you can see the breakdown in that diagram there. We've got about 3 minutes left. One of the things that's interesting about waste, and if I can encourage you, any of you, to get excited about, is how do you deal with the stuff that you don't know how to deal with. So we've just finished an exercise where we have 30 million gloves, rubber gloves, that go to landfill each year. And what we do is we do a few things. One is can we use less? So there's been a really successful project run by our clinicians, which has been called the Gloves Off campaign, which is being supported by clinical research, which says we actually don't need gloves in all of these circumstances. So don't use them. So we're reducing the amount of usage. Then we were exploring, can you dispose of these gloves in a sustainable way? Can you reuse them for other things? We've found that some plastics we've used for our road base in our hospital roads, we've used to make furniture, we've used to make tabletops. We've struck out in terms of gloves. And we look at then the other end of the scale, which is, can we purchase something that's green, or can we purchase something that biodegrades? And we've struck out there. And this is the exciting bit. This is where the opportunity to partner with the private sector, to partner with university groups, to research and innovate about what you do with that type of plastic for that glove. And that's the realm that we're sort of playing in at the moment. We've got a whole raft of interesting sort of waste projects. Gloves Off, I've mentioned. E-water, if you don't know what that is, please look it up. Reducing our food waste. The other exciting one is we've just done some uniform recycling, 2,000 staff uniforms, working with the University of Newcastle. We're turning that into tiles, bathroom tiles, which are going into some of our infrastructure builds at the moment. Last slide. This is the game changer, I think. And in terms of operating in government, this is the stuff Treasury is interested in. This is savings, and these are our savings after the first 3 years, recurrent savings, which are being reinvested into frontline clinical services. And I think that's my 15 minutes allotted.
Thank you, Ramsey. Fantastic to hear how Hunter New England are achieving and surpassing the targets that they've set. And it sounds like you've got some exciting initiatives lined up for the future as well. It's now my privilege to introduce our next two speakers. Dr. Aunty Bilawara Lee is a senior Larrakia elder, traditional healer, and author of several books on Indigenous healing and culture. She is Charles Darwin University's Larrakia Academic in Residence and is currently advising Charles Darwin University Menzies on the First Knowledges curriculum of their nascent postgraduate medical program. Joining her today, Dr. Mark de Souza is an emergency physician and sustainability, climate action and health advocate. His work establishing the Royal Darwin Hospital Campus Greening Project has led him to embark on a PhD that explores the mechanisms connecting biodiversity and health in healthcare settings. Welcome to you both.
Thank you, Sarah. Wonderful. So Aunty Bilawara and I are very honoured to be invited back a third time to give this time a 3-year update on the Healthy Patients Workforce and Environment Initiative at Royal Darwin Hospital, which you see twinkling through the plants in the background on this slide. The H3 project, as we fondly refer to it, began as a grassroots collaboration between hospital staff, Indigenous leaders, and climate scientists to spearhead lagging climate adaptation and mitigation in the top end's only tertiary referral hospital. And our project was launched to provide immediate psychological first aid to a healthcare service that was at breaking point back in 2021. And at that time, staff morale was quite poor due to entrenched overcrowding and staffing shortages, which continue today. We also noticed that frontline staff had become exhausted by the COVID-19 pandemic response, and critical incidents and patient complaints were soaring. We know that Indigenous patients are overrepresented in Australian hospitals, and here at Darwin, they make up more than half of Royal Darwin's inpatients and 8 in 10 of our renal dialysis patients. And for Indigenous Territorians, access to healthcare comes at a price. They're disconnected from country, their family networks, and their place-based spiritual, cultural practices that include the use of bush medicines to this day. And Indigenous patients, we notice, prefer to sit outside the hospital where they can be unconstrained by the built environment of Western healthcare systems. And yet the hospital campus was incredibly and remains incredibly inhospitable. And this is only going to worsen as North Australia's climate predictions unfold. For example, by 2070, if we continue on current emissions pathways, Darwin may well see temperatures over 35 degrees Celsius for 3/4 of the year. The H3 project also accelerated Northern Territory Health's sustainability advocacy, which had begun in 2019. We were also mindful of the worsening biodiversity crisis in Australia, which was being exacerbated by the clearing of adjacent biodiversity corridors to the hospital that were known to support over 270 species of native birds. And that's a number that equals 1/3 of the total number of species that exist in Australia today. Before our project launched, you'd be hard-pressed to find a cool and restorative place to defrag and unwind. And as this image shows of the pathology department's break area at the time, the hospital's infrastructure was rife with urban heat islands and poorly adapted to climate. In response to this grim reality, which I've just outlined, we launched the Royal Darwin Hospital Campus Greening Project, modelled on 4 pillars. They were to create cool, climate-adapted green spaces that would adapt to climate change, improve the well-being of the workforce and our patients, promote Indigenous cultural safety, and increase local biodiversity. We secured sufficient funding to kickstart our planting. We recruited volunteers from the workforce and community, promoted by staff communications and a social media campaign. And a CSIRO scientist called Stephen Cook generously donated his expertise to assist our campus users to map hotspots. We also launched an active mobility campaign to promote cycling to work that would improve well-being and reduce staff transport emissions. And since 2021, our volunteers have installed over 1,200 plantings in 17 zones. And this includes over 157 local native species of plant and half the species of the plants that Aunty Bilawara and her colleagues determined were of Larrakia cultural significance. We now see and hear over 18 species of native bird on campus. And these efforts have been published in our case study, which I'll show you a QR code to later. And the media that surrounded our project and this publication has led to influencing the commission of the Royal Darwin Hospital Landscape Master Plan. The H3 project amplified the work of our Sustainable Healthcare Committee, which we had stacked with senior clinicians, allied health staff, and executives so that we could spearhead collaboration within our hospital, across government sectors, and Australian sustainability networks. And I remember reaching out to Ramsey and his team back at that time. I'm proud to say that all of our efforts have led to the recruitment of the Northern Territory's first Director for Sustainability Action, and now 2 team members. And I'd like to take this time to personally thank the leadership and hard work of Maya Van Bruggen, Lynette Smart and Jade Tavan for their dedication in drafting Northern Territory Health's first Sustainability and Climate Adaptation Strategy, which is due for launch in just over a week's time. I'd also like to acknowledge the work of Sonia Chanchlani and Ben Dunn from Doctors for the Environment and the University of Melbourne, who've been instrumental in getting our sustainability strategy up and running. So where is our greening project now? I think that's what everybody's after, 3 years on. Well, these images show the daytime surface temperatures on campus, on the campus at Royal Darwin can exceed 55 degrees Celsius, but it's worse if you're a motorist. Your car the surface of your car can exceed 65 degrees Celsius to the touch in full sun. I can only imagine that the internal cabin temperatures would be even more extreme. And our biodiversity corridors now show an average of a 30-degree Celsius reduction in surface temperature. And in the central image, you'll see even this small irrigated acacia reads much cooler than the surrounding ground, which demonstrates the cooling benefits of nature-based climate solutions. And they're using irrigation, canopy shade, and evapotranspiration to achieve that cooling effect. And the right-hand image shows a now well-used footpath that was ground zero for our planting efforts. And the thriving green spaces that you see in this in the top image increases the thermal comfort of the area and engagement in active mobility, which is great for health while reducing transport emissions. Our project is increasing food and habitat for native fauna, which combats the harm of urban sprawl. Fauna encounters have been shown to improve the quality of nature experiences. They make us feel happier, and they encourage us to think about a reciprocal nurturing relationship with nature. The Royal Darwin Hospital Campus Greening Project is creating restorative, climate-adapted spaces like this, where staff and patients can take a break from the hardship of delivering and receiving hospital-based care. Studies have shown that even 5 to 20 minutes of exposure can reduce stress in our patients and their post-surgical recovery time and their need for analgesia. In the staff realm, other studies are showing that staff members are more productive and that they actually are basing their employment decisions on being able to access green spaces like this at work. And I think this is instrumental in planning for workforce stability in a warming climate throughout Australia. The project is particularly important for Indigenous patients for whom connectedness to nature lies at the core of Indigenous culture and their social and emotional well-being. And we believe our project's emphasis on plants of Indigenous cultural significance promotes cultural safety. And in time, we hope to demonstrate through research that this improves hospital health outcomes for our priority Indigenous patients. And on that, I'd like to ask Aunty B to share a few words.
Yeah. Good afternoon, everyone. It's really good to be here with you. Our role as Larrakia elders or Larrakia people is really important because the hospital sits on our country, that we look after people to come here. So by working with Dr. Mark and greening the lands of the hospital, we'll get the word out to the community that want to come here. They've got access to healers. The own healers have permission to go into the surrounding area and get in bush medicine, bush tucker that need to help for two-way healing. Malawan, the ironwood, is fundamentally for our smoking ceremony, and that's a basic must-do for every healing. So I can access, other Larrakia people can access, but I let know the other healers from around the country that can use the ironwood for a smoking to help. The community person is a hospital, and it's so good. It's close, it's handy, and have to not go out and look for it. So it really helps.
Thanks, Aunty B. And in terms of wellbeing outcomes more broadly, we've only been able to collect informal feedback through our social media and face-to-face and email feedback channels. But overwhelmingly, this is very positive. And staff and patients are saying that the biodiversity corridors make them feel cooler and happier. Some staff are even describing parking furthest away as they can, so they can take the longest walk through the corridors at the start and the end of their shifts. And other people are even saying that these corridors are getting them to engage in more nature-positive encounters in their home and land care efforts, for example. If you'd like to know more about our work, this QR code will take you to our study. And our last slide talks about our next steps. Right now, I'm one of the stakeholders in the engagement group that's supporting the final development of the Royal Darwin Hospital's Landscape Master Plan. And our role after that is to campaign for funding to actually implement this plan and also secure its long-term maintenance by an employed workforce. Aunty Bilawara and fellow Larrakia elders are busy helping the new Charles Darwin medical curriculum to develop its modules in bush medicine and traditional healing knowledge in time for their first intake of 2026. And we're hoping that the native plantings can be incorporated in the workshops. And meanwhile, Flinders Rural and Remote are developing sustainable healthcare and climate adaptation curriculum. Anything you want to say about that?
It's really important. And I get healers from other communities ring me say, it's making the fear and anxiety and pain that people feel having to go to Darwin lessen, because they know they have access to the bush medicine and the healers here. It's really important.
Thank you. And for my part, as was mentioned earlier, I have embarked on a PhD to dive more deeply into the potential well-being and organisational benefits of providing biodiversity, place-based biodiversity in hospitals. Thank you very much.
Mama, thank you.
Thank you, Aunty Bilawara and Mark. This project, I think, is just such a great exemplar, isn't it, of nature-based solutions to climate change, but then how that also contributes to, patient safety, patient healing, and cultural safety. Fantastic to get an update. I'm sure you'll be invited back for future presentations as well.
It's really important because they're passing all this on to the younger generations, both black and white, in the medical system.
Absolutely. Couldn't agree more with you. So our final presenter this session is Renae McBrien, who is the Sustainability Consultant for Children's Health Queensland. Renae is passionate about building sustainability into our healthcare system by advocating for high-value care with low-carbon care, removing over 1 million pieces of plastic from procurement, establishing 42 recycling streams, a medical market day, and a sustainable asset management system. You may have seen Renae's work on the ABC's War on Waste, and she's also won Clinical Excellence and multiple Waste Smart Awards. Over to you, Renae.
Thank you. What a great introduction. Thank you. I just want to double check that you can see my slides before. Is that confirmed?
We can indeed.
Oh, what a joyous moment, because it was getting a bit stressful. So great to be with you. I am coming to you from Queensland Children's Hospital up in the Sunshine State. And I have 15 minutes with you, and I want to come from a different angle and really just focus in on clinical sustainability, because as a background as a radiographer, that's been my forte, is trying to actually understand the function of health and change the way we deliver healthcare to actually minimize our carbon emissions. So with maturity, we're coming out of our last environmental sustainability plan, and I'm about to write our third environmental sustainability for our organisation, which shows the maturity and the commitment that we do have. But just to unpack what we've achieved out of that last plan is that we've actually managed to achieve 1 million pieces of unnecessary plastic completely removed from healthcare, and I'm going to walk you through how that's possible. We've also achieved a 44% diversion rate from landfill. So what that means is that out of all the waste we actually generate, 44% is in resource recovery, recycling, and charity missions. So I'll also show you examples of that. But that actually means 500,000 kilograms is actually diverted into resource recovery, which is large scale volumes and amplifies how much waste we do generate in healthcare. We've only been able to do that through 11 sustainable community partnerships, and that's about reaching out locally and finding the people who want our materials and who want to build circular economies. And we have done that by developing not a one bin fits all, not a commingle or mixed recycling bin, but 42 dedicated recycling streams. So looking at our materials and resource recovery in single stream and not looking to blend and looking to build value into those materials, which is really important. And I won't go through the 42, I won't bore you with that, but I will go through a few of them with you today. But also what we have done, which is what I've been doing all morning, is actually developed a direct legal relationship with international aid. So just this morning, I packed up our monthly donation, which goes over into the Pacific Islands to build health equity on the planet. And we do that not just through a handshake at a loading dock, it's through legal governance, through our lawyers and through our risk assessed and governance process, which is really important as well. But the big kick out of all this, like Ramsey was saying before, is that actually when you do all of these sustainability activities, you generate income or financially favorable outcomes. And we reached $1.7 million, which goes to show that when you actually deliver these key points to the healthcare system, you deliver environmental sustainability in parallel with financial sustainability. And then you also deliver on that corporate social responsibility, which is really important. So I'm going to jump right into it because we've got 15 minutes and I want to unpack things that are meaningful and tangible inside our healthcare. So looking at how on earth can we eliminate low value care and deliver high value care, which really does equal low carbon care. And that's kind of a little catchphrase that we want to drive low carbon care. Is we started looking at our supply chains, what we use in our clinical practice, and how can we mitigate and eliminate single-use plastic. So we actually removed every single-use plastic tray from our healthcare service. So no longer do we have plastic injection trays, those blue flimsy trays. We have gone back to reusable under infection control guidelines, and we've done that through Clean the Green program. So this allows us to then clean those green trays. They do not go back to CSSD. They are cleaned using the standard 3 infection control cleaning guidelines. And we've eliminated about 250,000 of those every year. Another way we've changed the way we deliver care is to actually build confidence back, I guess in a post-COVID world, to actually use PPE appropriately and empower our clinicians to understand what is appropriate use. So I work across 2 hospitals. In one hospital, when I do an ICU round as a radiographer, it is mandated that I wear gloves, an apron, and a plastic bag on my detector for every x-ray. So that's about 300 pieces of plastic per x-ray round. At the Queensland Children's Hospital, we've actually stepped that down and said that if you are not exposed to bodily fluids, there is not an infectious status, and you feel clinically confident to perform the examination or task with the patient without PPE, we simply don't have to wear it. And we replace it with good hand hygiene, which is, again, standard 3. And this has eliminated 300,000 pieces of plastic throughout the year as well. What we've also done to eliminate that low value care is looked at how we use linen across the hospital. So of course we need sheets on beds, but do we need a sheet on an x-ray table or in every outpatient area? So that's part of what we have done, is eliminated the unnecessary use of linen in our outpatient and those sort of high turnover clinical areas. And we've also gone back to some of our reusable curtains, which is kind of a controversial one because we're all leaning towards going to single use. But in our outpatient areas, again, we've gone back to reusable curtains and transitioning through. We also do an annual and probably biannual, I should say, review of our surgical packs. So identify what is critical to be in that surgical pack to ensure that when we're buying in those surgical packs, they have the only essential items that are needed for that procedure. And all of that eliminates unnecessary use and has the onflow of financial obvious sustainability because we're not buying things anymore that we don't need. Another thing that's really important is actually looking at the concept of how to get to net zero at 2050 without an offset. So we do need offsets to be able to achieve that. And some of our clinical practice is actually already taking us there. So when you think about telehealth or hospital in the home or even the work from home model, all of that is a carbon offset because we've stopped immobilizing transport and logistics to move people for clinical care. So one of our future goals is to actually build that carbon accounting into it and actually understand what is the offset of all of those activities that we've become very accustomed to since COVID came through. But I guess one of our big wins is that we do have a sustainable waste management system. So actually looking at our waste differently, valuing it into streams that actually build value and build partnerships. So what we have done there is actually looked at the Global Green Healthy Hospitals targets of what the occupied bed day. So that's by saying the function of your hospital versus the waste versus if I have a spinal hospital or if somebody has an outpatient hospital, there's different types of waste that we actually generate because of the clinical care or the practice inside our hospitals. So looking at those targets, it's 7 kilograms per occupied bed day of general waste, 3 of clinical and 2 of recycling. And you can see when we've done that deep dive analysis that we're actually exceeding those goals, which is really great. How we've done that is done a complete and utter performance review of our waste streams and looked at them from a financial and environmental impact and then for the opportunities that are being missed. So one of the first things we tackled, which is quite an easy for any hospital to adopt, is actually to start looking at clinical waste streams. And the most expensive one of all is our regulated waste streams. And we realized it was about 60% of the hospital waste budget. So what we did is run a massive campaign across the hospital to start empowering and educating our staff, updating our education posters to make sure our clinicians, in consultation with them, we co-designed new posters and signages so that they understood exactly what was meant to be going into those bins in Queensland. Then we developed a bin strategy. And in clinical areas, we consulted with everybody throughout this course of the project, and we built the education into that, and we moved bins. So you're looking at a photo of our ICU rooms, and you're seeing the clinical waste bin like a little dot at the back there. And that's because we moved the bins in strategic locations. So clinicians still had access to the regulated waste, but it wasn't in a convenient drop zone to actually build up those contaminations. So when we did all of that, what we learned was that we can avoid and prevent contamination in our regulated waste. So we actually managed to get our regulated waste down about 10 tonnes per month, and it maintains at that level as well. So when we can reduce that, we have a financial impact. We decrease, I should say, our incineration. And then also we save about $64,000 a year. So a simple thing like a bin strategy is really important. What we actually did there, though, is by eliminating so many bins and moving them out, is we actually saved holistically about $150,000 ongoing every year because we removed 320 unnecessary bins from clinical care. And then also that gives our cleaners more time. So we add 2 extra cleaners every year that can actually go and do other functions in the hospital. So it's had a flow-on effect. Another process we've done is looked at paper and cardboard. It's a value, it's a material, it's easily recyclable. But what we wanted to do is looked at how we use it. How do we use it in health? And when we look at digital citizenship and digital platforms and applications in health. So what we've actually done since 2020 is reduced our waste down, our paper down by 2.35 million pieces of paper every year. And that's through digital adoption of our clinical practice. So that is $1 saving every year just by not using the paper, with a 44% reduction. And it actually leaves 300 trees still on planet Earth, which is the best carbon currency we can leave. So the next we talk about is metal. Metal, we've done a really broad understanding of what metal is produced in health and developed a process for all types of metals to be streamlined into our metal recycling. And on average, we generate 1.5 tonnes, mainly of clinical metal, and that's aluminium from theatres and single-use laryngoscope blades. It's also gold and platinum iridium from sleep studies and cath labs. But ultimately, when we collect all of that metal meaningfully, it generates income because it's worth of material out in the recycling industry. So it generates about $18,000, saved about $8,000 in waste costs, and about 25 tonnes from landfill, which is really great. And it creates that circular economy. We've also developed an advanced recycling program, and that's talking about how we can actually start to look at plastics differently and look at where and how we can capture those in health. So hospital plastics are really prolific if you've worked inside our operating theatre. So medical plastics, the value of it in America is about $31.7 billion. And they produce in America about 1.7 million tonnes of plastic every year. So we don't have that data in Australia, but we certainly do have a high level of good quality plastics coming through. So I'm working at the moment with the CRC, Solving Plastic Waste, which is a nationally funded research program, has $140 million to drive, and medical plastics is one of their highest objectives, is to actually look at medical plastics and build a circular economy, understand what our plastics are. So you're looking here at the average plastic generated from an operation, And you'll see that the numbers are on some of them, and there are some that are just unknown. A lot of our vendors and medical suppliers are creating plastics and not telling us what they are, or building complicated medical plastics that we can't recycle. So understanding our plastic and researching that is our next steps. And that's really important because it's actually on the National Federal Minister's priority as well, to understand medical plastics and to drive circular economy. So I'd encourage you all to reach out to that. We've also implemented a blister pack recycling program, which is really great. And we've actually used the money from our Containers for Change to drive that through our green team, which is really great. But one of our greatest things we've done is actually look at low carbon care, by looking at some of our medical consumable management and waste, because the most expensive waste stream in any hospital is expired consumables, because the system that we all get to work in is really good at buying things and keeping the stock on the shelves. And maybe it changes a par level, but the system does not quantify the loss of consumables that haven't been used. And then we need to develop systems that actually understand the quantity and quality, the value of the loss of consumables, and then mitigate that with the system. So what we have done at the hospital, that's a different one, is develop a medical market day. So this has been groundbreaking. So what it does is it stops our hospital every month, and it allows all clinicians to review our expiry dates. And if anything is between 6 to 8 months, 1 to 2 months of expiring, we bring it up to the auditorium and we have a live swap meet. And that has been a change in our practice and a change in our culture. Staff love it. They'll change their shifts to make sure they come up. But ultimately, it has had an 80% reduction in our expired consumables of waste. And that is not insignificant. It's about $800,000 in cost-saving benefits across the organisation just by mobilising an internal supply chain and management. And then at the end of that, we've actually been able to get about $54,000 exchanged into other Queensland hospitals. Because at the end of the market day, if we've defined that we can't use them here at Queensland Children's Hospital, we then move them out to a neighbouring hospital, and working within Queensland Health as a broader organisation rather than just inside our HHS. We've also developed an internal platform which is kicking goals every day. It's just a team space. It's an internal social platform where people can post on there that they've got a filing cabinet or a chair or a medical trolley that they no longer need, and allows our staff to pick it up and redistribute. This has had about a 95% success rate and saved $110,000, about 120, I should say, in saving from new purchases. So it's really got a high level engagement, and it's fostering that sustainable culture. So about 338 staff are involved, and 423 items were transferred and redistributed in a year. It's really amazing. We've also have our asset transfer here in Queensland, which allows us through Queensland Health to generate income and revenue from the assets, and we can sell them out to external communities and partners and enterprise and businesses. And that allows us then to rescue, repair and reuse. It allows us to do something as simple as to recycle our Clinell buckets. We sell them through that website to local painters, which mitigates them from going to buy plastic buckets, and we generate a revenue, developing value around our materials. We can connect our expired consumables if we can't move them into the vet industry, and we can generate revenue from that. But it also highlights that sometimes our sustainable asset management across health needs to have better systems. So this is an example of something that's happened in Queensland Health, is that we needed an X-ray screen in our operating theatres, yet we didn't have the budget for it. And then I saw one being sold in another hospital. So what I could do then is actually work about sustainable asset management transfers across hospital healthcare services. So if one hospital has an X-ray screen and the other wants it, we can manage through working on logistics and intercompany asset transfers to work cohesively as a health entity rather than working out in our silos. And that's what we've been able to do, is to develop a sustainable asset management that allows us to have transfers within our hospital services and across other sectors, which is saving a lot of money as well. But at the end of the day, just like this morning, there are things inside our hospitals that are no longer fit for purpose and could actually still be used and can actually have a high. So we have developed a CHQ International Aid program, which allows us to donate end-of-life resources, materials, and send them overseas into the neighbouring Pacific Island health communities. That includes our Crutches for Kids program, that's using any single-use rehab or moon boots to coming back into our ED, ortho or rehab areas, and co-designing that program with our patients to get those single-use items out into those health communities. So what we've been able to do is establish the legal governance to actually donate some high-value assets into international aid to build health equity. So an example of that is you're seeing a picture there of 2 heart-lung machines. So all children in the Pacific Islands do not have access to having an open heart surgery. They do not have the equipment or the skill set. So at the Queensland Children's Hospital, we're retiring 2 of those equipments after 10 years. So instead of selling them, we worked under legal governance to donate them into the Fiji Children's Hospital. And when we did that, we actually then sent over 25 of our staff from critical care in a volunteer capacity to teach them how to use that machine, to actually teach them to maintain, to teach them how to step down the patient from ICU into the ward, into the community care. And then we were able to leverage and build health equity for children on the planet, which allows all children now in the Pacific Islands to have access to heart surgery in those areas rather than being displaced overseas. So I will finish there and just wanted to share with you that our program has been an award winning, and the reason why is because it is very socialized and embedded into the foster of our hospital and our everyday BAU. Thank you.
Thank you so much, Renae. It's wonderful to see how Children's Health Queensland really continue to lead and drive change, particularly in the way that you manage and reduce and approach the waste problem in general, but also really inspiring to see that you're on your 3rd sustainability strategy. That gives hope to all of us, I think. So I just wanted to thank all of our presenters for their wonderful presentations. We are going to move to a Q&A session, but before we get started, we're going to be sharing a Mentimeter link in the chat and a QR code up on the screen. And it's just an opportunity for you to have a think and reflect on your key takeaways that you'd like to share from this session. And we will start to see, I think, people's responses come up live as well on the screen. So I'll just give everyone a few minutes to get the phone out and get linked onto that. And just a reminder for people as well, if you've got any questions, to pop them into the Q&A, and we'll get started with questions soon as well. Okay. All our presenters are ready. We might move into the Q&A part of the session. And there's a couple of questions that are coming through already, but I do encourage others who have them to please pop them in, and I'll make sure they get passed along. So the first question is actually for Dr. Awad, and it's asking if you could comment on clinical waste disposal and how it's separated into landfill and incineration at Hunter, New England.
Look, it's done, and as I mentioned in my presentation, we're really relying on councils to have the infrastructure to deal with that waste, and it's done at a few different spots, but mainly done at the point of disposal on a ward or in an operating theatre with the bins that we've set up in those places. There is sometimes that stuff gets a bit lost in the mix, and our sustainability team is so dedicated. I think they call themselves bin divers. They often get in there and do a bit of a reshuffle. But as I said in the presentation, it's really difficult to train staff to put it in the right spot. One of the things we're doing is we're partnering with a private sector group now that's using artificial intelligence to set up a series of bins, so with a camera, and as a clinician walks to that bin with something in their hand, the camera looks at what that is, that waste, and opens up the appropriate bin for it to be dropped in to sort of essentially make them put it in the right spot. So that's a 12-month project now that we received some funding for, and we're sort of 3 months into that sort of program. So it'll be interesting to see what that yields.
Yeah, it's fantastic, isn't it? So many different uses for AI and all the various sort of tech advances that we're seeing come through.
If I could only get, I might get one for my children if they could do the same thing. That'd be lovely. But
Renae, I didn't know if you wanted to also comment on, I guess, some of the potentially sort of the behaviour change principles for staff in terms of getting that education around waste management and segregation and what your experience has been like there.
Yeah, I mean, I can only speak for Queensland, but I just know when we graduate, all of our healthcare professionals, nursing, medical, allied health, admin, all of the professionals and workforce that come here, none of them had had formal waste education in any of their university degree or qualifications. So it's really about onboarding them here in hospital, and it's not often mandatory. So it's been retrofitted, and we're always trying to retrofit that waste education. So I am adamant and definitely passionate about face-to-face education, and I'll go up to operating theatres and go on the journey with them, because it is quite a complicated point of segregation. What's pharmaceutical, what's anatomical, it's all very difficult. So I actually think we're still retrofitting that education, and we need to catch up with some formalised education through universities, and then we can onboard staff who are already understanding what our EPA and legislative requirements. So it's really important when we talk about the financial environmental impact, and what I know about healthcare professionals is if they know and they have that knowledge, they absolutely go and act, and they'll change the way they actually drive their waste services. So yeah.
Thank you so much. One of the other questions that's come through has asked essentially, I guess, about resourcing in your various hospitals and health services, and what sort of dedicated FTE you have to sustainability. So I might throw that open to the group.
Ramsey's best to answer that one.
Okay, I will. Look, in our first couple of years, it was just me and maybe, I don't know, a fifth of my time, 1 day a week. And Alyssa Klinkenberg, who I'm sure a lot of you know, she's very famous these last few years of the work she's done. She was full-time, brought on as the Director of Sustainability. And since then, in the last year and a half to two, we've brought on Alana and Amy, who both bring great skills. Alana has expertise in the community space. Amy has expertise in the acute space. So they've been working with those different clinical groups who have different cultures and different approaches and different language. And then we've got someone in our asset management team, Phil Grolton, who's been managing all the big infrastructure stuff, solar panels, LED lights, and EV charging. And then the last person, who's probably the shyest person in the world, I think I've only heard him say one word in the last 4 years, is Sam, who on a part-time basis, he's got other roles, does all the data reporting and creates all the nice pictures and so forth. But that's essentially it in terms of core team. And then it's all the other staff who have other roles who do their little bits and pieces within their environment.
Thank you so much. Renae, did you want to add something?
Well, with all sustainability, it's always been skeleton staff. And I think as we mature, understanding what sustainability workforce is, it's actually should be embedded into everybody's practices, but it's the performance and reportability. So we're establishing now as an actual task force with high-level key stakeholders to also ultimately to embrace them, to go out into their workforces, to do asset management, to do the EV fleet and come back in a reporting capacity. So then ultimately there will be just my FTE. And then as of next week, I'm getting another full-time staff member. So the unit is building, but I do think it does need clinical leadership. It needs infrastructure leadership, and it's embedded across all aspects of health. So it's not just for one person to drive and lead. It definitely needs leadership in a unit.
Absolutely. We've got another question here, which I might ask to Aunty Bilawara and Mark up in the NT, because it's about the importance of community and hospital users being part of the solutions. And so if you wanted to comment on that, but also how you keep community then up to date with your progress.
We have a saying in the top end, gossip is faster than a speeding bullet. So tell people, talk, every event, every social media, families go to hospital, we tell each other word of mouth is so powerful. And you also, different organized key orgs has newsletters, Larrikey Development Caution, Danilo Dilba, AMSAND, Northern Lands Councils. Just put a little thing in there, and everyone knows where to contact me or ring me. I can't escape.
The Greening Project has also got a social media group called the RDH Campus Greening Volunteers on Facebook, which has 3 years worth of outputs. And there's about 300 members there who are community members and staff members. So there's that stream. There's also various, within the staff forum, there is now an intranet page that our Director of Sustainability Action has put up that is putting links out and briefings out about the Campus Greening Project in the climate adaptation space. Our mother organisation, NT Health, has been developing some outputs in terms of reels that we're working on to then put through other official social media channels. So it's about. And the other way of getting this through is through the land care community. There's quite an interlinked network of small, very committed land care groups through NT Land Care, run by Emily Rasso, and there is a sharing of human resources and knowledge across those groups. So that's really, really powerful to see.
A couple of things. CDU talks about establishing Larrikey Bushman's Garden. It's ongoing, but I have real connection for years of being the board of Territory Natural Resource Management, and all the rangers. I tell all the rangers to go home. Huge network and border forces. Tell the community when they come to Darwin that's happened, and people ring me.
Yeah, it's a wonderful network, isn't it, that's building across Australia, and so many opportunities, I guess, for us to partner with people, like you said, with the rangers who aren't necessarily in the health sector, but so many synergies there. Thank you so much for that. Another question has come through, which again, I'm going to open up to everyone, because it's about where you have found the most difficult or surprising barriers and how you were able to overcome them. So I don't know if anyone wanted to take the lead on that question.
I'm going to jump in. I think increased governance that's occurred. Like the Ministry for Health it's fantastic. I love them dearly. If anyone is listening from that group, I know they are. But when we first started this project, or a lot of our decision making was just done locally by me, and I sit on the executive Hunter New England Health, so we were able to do things a lot quicker. And now there's more governance, which is great. There's funding that's provided for the ministry for staff, which is great. But now, while we get into the harder stuff, we're having to jump through more hoops and more people to get movement in terms of, say, Health Share, who we need to partner with to move the waste and to collect the waste and so forth. And moving through those big parts of the organisation are really hard. Equally with health infrastructure, they're a big beast as well. And everyone has to consult with, a Clinical Excellence Commission. We've been trying to get something around e-water, which has TGA approval, which would save a lot of money and save a lot of chemicals going down the drain. But a lot of our decisions now have sort of gone up and been caught up in existing governance structures, existing policy structures, existing approval structures. And everyone has good intentions and everyone's doing their best, but that's a big frustration for us. I feel like we're going a lot slower than we used to go. We haven't overcome it yet. I think I'm overcoming it by discussing it openly and transparently with people, and getting my chief executive more involved in having those chief executive to chief executive discussion, so we can fast track stuff through. There's just things feel slower from my perspective, I guess, and that's probably my major frustration at the moment, if I'm being very honest.
For me, politics is the biggest burden. I just get a really good relation with the boss of health, Minister of Health, and change the head, and it could start again. Politics, I think, is my biggest barrier.
I think we may have just lost you there, Aunty Bilawara. Is anyone else struggling with the...
Yeah, I was, yeah.
How about now?
Did you want to try and say that again?
Can you hear now?
No, I think we may have lost audio from the NT. We might come back to you in a couple of seconds. Renae, did you want to make any comment around, where you've been surprised by where there's been a barrier?
Yeah, I was just thinking back from our last, CAHA presentation a few years ago to now, and I think it's been really difficult to develop the governance and to actually build that funding and FTE support. That's been the really frustrating thing, because we can all show the quality of work and what can be done, and the actual opportunities inside health, but we do need those resources. We need the governance and the funding. But what's exciting is that noise is coming from outside of our hospitals now. In Queensland, there's a whole lot of conversations around it at a higher level, at Treasury level, to talk about how we can build those resources and actually fund our HHS services to drive sustainability. So it's no longer this sort of passion project, which is how I've evolved into this role. It's been very passionate. I'm very deeply connected to the planet. This should just be how we want our healthcare services to actually be in our community, so that they don't affect the planet and they are protecting our people. So I think the most frustrating, I guess, is just to get that governance correct, to get the FTE, to change role descriptions so that they are, with our procurement, for example, procurement must have sustainability criteria inside our RFQs and things like that. That governance and system thinking is probably the hardest frustration. But there's a lot of frustrations, but there is a lot of joy in sustainability as well.
Absolutely, well said, Renae. Might just pop back to the NT to see if we can hear, because I did really want to hear what...
No luck? Can you hear us or
No,
no?
that's okay. No worries, that's okay. That's all right. We've just got a couple of minutes left, and I just wanted to end, I guess, on a sort of a more positive note. So very important, obviously, to acknowledge, what some of those barriers are. But what's sort of a take-home message that you'd like to give everyone here listening in terms of, I guess, where you've found support or enablers that have really helped your organisation, be one of the leaders in this space. So maybe we'll start with you, Ramsey, and then move to you, Renae.
I think the staff and the community want this, and I remember the first time we presented our strategy 3 or 4 years ago to a rural community group in Tamworth. It was part of our annual general meeting, and there was a whole stack of really impressive presentations about great things people are doing in neonatal intensive care and just remarkable stuff that blows your mind. But when I presented this, and it wasn't because I presented it, I'm a bit average, but the topic they loved, and we got people standing up and clapping, because I feel that particularly in our regional areas, people are feeling the brunt of global warming, whether it's a drought or a flood or a bushfire, and it really destroys and affects people's livelihoods, and they're at the coalface of that drama, and getting them on board, regardless of how far you move the needle, is something that brings a lot of worth to this endeavour, because it's tangible and real.
I would reflect on that as well. I actually reflect quite personally on when I heard Mark speak. Probably it was beginning Mark did a presentation which was profound, and you actually cried in it. And I don't know if you remember this, but it's the depth of people's connection to the vulnerability of our planet, the vulnerability of ecosystems, and then the purpose of health. So I actually think as healthcare professionals, we're intrinsically, organically designed to want to help, protect, and preserve, and not just people, and that includes our planet. So I think the most positive thing inside health is that we are all ready and armed to actually make a difference. And then I actually think when we have organizations, for example, like when I'll do a monthly, well, that's not monthly, it's probably every 6 months I'll walk around trying to get people's medical textbooks, and I'm talking to doctors, nurses, and trying to collaborate all of their old textbooks to send overseas. It's that connection to people, and it actually makes people want to work. It's actually about well-being as well as looking after the planet. So I think it's very important for any health care organization to implement sustainability as part of the well-being, to foster the culture, but also it's just about our position in the community to protect the planet as well as people.
Can you guys hear us?
Do you remember?
We
that?
can.
Oh,
Fabulous. Yes.
Thank you, Renae, for outing me for my emotion, but I do remember that.
No, it was amazing.
Yeah.
It was great.
Aunty B, did you want to say something?
Sorry for dropping in and out. A huge storm with a lot of lightning affects us. So I'm on a campaign to get to politics. The ones that's my barrier. So I'll just keep knocking doors and talk to people and bring the ancient wisdoms in, say, have we changed? Look back for the future.
Yeah. And what I wanted to say to add to Aunty B's words is that, your framing, Sarah, was about initially frustrations and how do we move through? And I think what I'm aware of is that we're in a moment in time where, if you remember the early adopter curve, the early majority, late majority, and the laggards, and the people who never turn, we're at this stage in Australia and globally regarding sustainability and the reasons why we've got to this crisis point of capitalism and extractivism, that there's enough people now who believe climate science, they know about it, and they're looking for leadership, which is where this is so powerful, CAHA's forum and all the people that have spoken today. But people are also beholding the ongoing barriers for real policy change. And I've specifically not used the term political change. It's about policy. And there is still policy settings and legislation that are impacting human and planetary health. And so we need to all be mindful of that, all step up and analyze policy and analyze legislation from the professionalism and the knowledge base that we have. And in our case, it's in human health and health system delivery. So that's equitable, value for money healthcare. And so we're at this moment in time where we have to push through this barrier where Australia is looking to entrench and double down for another 40 or 50 years in new coal and gas. And you've already hosted Doctors for the Environment CEO, Kate Wiley, in this forum. So that's the courage that is now required of us all, and to leave space for other people to join this movement of calling it out, and calling out about our health and planetary health, which is so interlinked. Non-human species health is so interlinked with our own well-being. That's where we need to go in the discussion.
Absolutely. Yeah, no, beautifully said. We're at a very critical time point. But I think a lot of resilience and strength amongst all of us who are here today, but also our colleagues who couldn't be, that we know are on this journey with us as well. So thank you so much. I would like to thank all of our presenters today for generously sharing your stories and experiences. That does bring us to the end of this part of the session. It's now my privilege to introduce Lin Oke OAM and President of Climate and Health Alliance to deliver the closing remarks. So Lin Oke was an occupational therapist and neurophysiologist who worked in neuro rehab, paediatrics, tertiary teaching of OT and neurosciences in allied health, prior to Health Services and Association Management. Lin was a key contributor to the establishment of the Kuri OT scheme in Victoria, Indigenous Allied Health Australia nationally, and Wuthunga Health Network in Victoria. Now formally retired, she strenuously advocates for climate action and support for Mother Earth. Over to you, Lin.
Thank you, Sarah. And what an inspiring session for us today, and to end a fruitful and transformative 2-week forum. As I commence, I wish to acknowledge the Aboriginal and Torres Strait Islander peoples as the traditional custodians of the land on which we live and work, and acknowledge the sovereignty, their sovereignty of the land that we call Australia has never been ceded. In CAHA, we commit to listening to and learning from Aboriginal and Torres Strait Islander peoples about how we can better reflect Indigenous ways of being and knowing in our work. I've been privileged to journey with the forum since the opening plenary, and it's been clear to me we have brought together the best and the brightest in this program. Delegates are CAHA members, supporters and members of the Global Green and Healthy Hospitals program. Through the Global Green and Healthy Hospitals program, we support hospitals and health services to learn, collaborate and act. We also recognise participants that have made significant sustainability strides, and that brings me to an announcement of a very special award. CAHA is honoured to present the 2024 Healthcare Climate Champion Award, the overall winner for the Pacific region. This award highlights those who have committed to the Healthcare Climate Challenge, a pledge to reduce healthcare's carbon footprint, prepare for the effects of extreme weather and shifting disease patterns, and educate both healthcare teams and the public on the critical link between health and climate change. The award honours an organisation that has shown outstanding dedication to climate-focused policies, public health protection, and a shared vision for a healthier, more resilient future for all. This year's Healthcare Climate Champion has demonstrated exemplary leadership, inspiring the entire healthcare community to take meaningful steps towards sustainability. A special shout out to those in the Pacific region who also received Healthcare Climate Challenge Awards, including Uniting Care, the Eye Surgery Hastings, and Your Community Health. Congrats. It's my pleasure to now announce the overall 2024 Healthcare Climate Champion for the Pacific region is Hunter, New England.
Oh.
I welcome Ramsey Awad from Hunter, New England to say a few words. Thank you, Ramsey.
Oh, the lovely words, and thank you so much. We're delighted to receive the award, and also congratulate everyone in this meeting and everyone in the forum who has been doing their bit in this space. And I guess I'm not going to repeat. You've seen my presentation and the work that we've done. I guess what I'd add to that presentation is that I know it sounds very impressive what we've done, but in fact, the secret is it's actually really easy to do this. It's really hard, but it's also really easy. And to make it easy, you need a few things. One is a supportive environment, regardless of the organisation. You need, at the highest level, you need the board or chief executive absolutely on board and committed to this. And I've seen lots of instances where middle managers are given the responsibility of sustainability and just can't get anything through because they don't have that seniority or executive seniority to sort of plow through the bureaucracy. And this is huge change for people. And there's lots of policies in health that block us from doing the things we want to do. So having that right support mechanism at the highest level is really important. The second is having that core team of people who are absolutely committed. And Alyssa Klinkenberg, Amy, Alana, Phil and Sam are exceptional people who just continue to live and breathe sustainability and do a remarkable job. And they make me and the organisation look very good. So a big thanks to them. But having that very small core team doing their bit is critical. Finally, staff, and I mentioned this in terms of one of those questions, staff and community who want to do their bit and drive change and make it sustainable is the third element. And I keep coming back to the finances because it's every meeting I go to on the executive, we're talking about the financial situation we're in, and within every state government post-COVID, we don't have much money. So I guess the last message that all of you should be giving to whether it's Treasury you're engaging with or your CFOs is that our experience now is that every dollar we've invested in sustainability, we're getting about $4 back. So financially, it makes sense, and there's really no excuse for us, for all organisations to play a significant role in sustainability, and we just need to get on with it. Again, thank you very much. We're very humbled and honoured to receive such such great recognition from incredible peers. Thank you.
Thank you, Ramsey, and congratulations once again to Hunter New England, our 2024 Healthcare Climate Champion. Your commitment to a sustainable, climate-conscious healthcare system is truly inspiring, and I think we've been very lucky to have you presenting at the beginning of this session so that we can absolutely understand why you received this award.
Thank you.
Together, we are setting a powerful example and paving the way for a healthier, more resilient future, is my sense. So, over the past 2 weeks, we've immersed ourselves in the world of sustainable healthcare through 6 incredible sessions, 3 workshops, case studies, posters with leading examples and connections with our partner, Bupa, and online speed networking. We hope that as you exit this forum today, you continue to reflect on the conversations and presentations which took place over these past 2 weeks. Throughout the forum, we've noted some of your takeaways, which we'd like to share back with you now. In our opening plenary session, the speakers set the scene with robust calls for action and honest dialogue about health, equity, and what's needed to build sustainable and resilient health systems and communities. We heard about the challenges we're facing today, the ingredients to green the healthcare sector, and what a healthy, regenerative, and just future looks like. In session 2, Changing Hearts and Minds at Every Level, the practical examples of bottom-up approaches within health systems inspired you, we understand. Utilising a diverse range of tools to engage, educate, and communicate leads to change. It's clear that the way we communicate about climate, health, and sustainability is essential, and language shapes understanding and inspires action. In workshop 1, Health Systems, A Warming World from Insights to Action, we explored the vital intersection between climate change and health, discussing how we can move from understanding the challenges to making impact within our health systems. It's so important to work together across organisations and sectors to create meaningful change. Change cannot work and occur in silos. In workshop 2, Indigenous Regenerative Sustainability for Climate and Health, they showed us that by bringing culture into our workplace and fostering connections to country and to each other, we create a sense of community and promote well-being. Thank you, Awad and Stevie from Sustainative, for not only reminding us about self-care, but also for providing practical tools to achieve it. In session 3, high value, low carbon care in action. What is it? How can you get started? Your feedback showed us that you were excited by the rapidity of the emissions reductions that are possible by minimising low value care. We heard more about the power of language, and know many of you will be reflecting on how to advocate for sustainable change through the lens of quality improvement. And we learned that before we can create meaningful change, we need to understand the baseline. Measuring our impact is critical to identifying areas for improvement and tracking progress. In the Caring for Country session, one learning came through resoundingly clear. Culturally safe care is at the core of sustainable care. Culturally safe care is preventative, high quality, and climate resilient. We heard about the importance of First Nations knowledges in shaping holistic approaches to sustainability and health. The threads linking climate change, health, and culture are undeniable, and outcomes described in this session demonstrated this. Workshop 3 was Making the News by Croaky Health Media. As Melissa and the Croaky team illustrated, our stories connect us, building trust and unity. They shape who we are and who we can become as stewards of this planet, our shared mother. Session 5 was Stories of Healthcare Resilience in Climate-Impacted Communities, and the presenters showed us the power of supporting and resourcing place-based resilience. There were many examples of community collaboration, activating local organisations to respond in times of crisis. Sharing our stories and resources allows us to learn from impacted communities and support preparedness and resilience across Australia and the Pacific. And now we've just heard from previous presenters at the Greening and Healthcare Sector Forum. Where are they now? And stories to progress. And hasn't this been a very heartening session to be listening to all of these healthcare climate champions, starting with Ramsey Awad from the 2024 Champion for the Pacific, Hunter, New England. Through your reflections in each of the sessions, we've seen the incredible value of this forum as a space to learn, share, and inspire each other. You are not only engaged with the topics, but also brought forward insights, solutions, and a sense of urgency that will ripple outwards. This forum has been a stark reminder that climate change is not a distant threat. It's already here, affecting lives and health worldwide. As we leave today, let's carry forward these lessons, deepen our connections, and continue to foster a collaborative, solutions-driven approach. Together we have the tools and the power to make a difference. Thank you all for your participation and dedication over the past 2 weeks. And let's keep building the momentum. So what are some of the next steps and opportunities? There is strength in our connection to learn and collaborate, and also to maintain our well-being as we endeavour to address the challenges we have discussed during this forum. Remember that as delegates to this forum, you will have access to recordings, case studies, videos, and to other delegates in the next 4 months. Take some time to stay connected and reflect on your learnings. If your health service is not currently a member of the Global Green and Healthy Hospitals program, we encourage you to join. We're extending the program with an official launch early next year to cover advanced approaches and topics that we have discussed throughout the forum. CAHA has over 100 organisations as members, and we also welcome individual members. Our members receive weekly policy updates and resources and join in our advocacy efforts. CAHA is re-establishing our expert advisory group, and based on demand from our young health leaders, we will co-design a youth chapter for CAHA in the new year. So please connect with the team if you're interested in these initiatives. And there's a code to click on to become a member, and you Google CAHA to get the contact details for our team. So I would like to conclude with my heartfelt thanks to everyone involved. Together we have created positive connections that we hope will propel everyone's efforts through the year ahead, while we reduced our event footprint this time. Thank you to our speakers and facilitators. Thank you for contributing your time and to sharing your leading work. To Bupa as our platinum sponsor, Roger, Camilla, without your support, this event would not have been possible. Thank you. To the ICMS team, Penny, Glenn and Jemima, for hosting the forum of this virtual forum. Thank you. To our steering committee, Maya, Francesca, Greg, Deepak, Ree, Kelly, Jeremy, Greg and Risa, for volunteering your time to help shape the program. Thank you. And to our attendees, thank you for being here, engaging in the sessions and with each other. And to Michelle and her terrific staff, special mention to Steffi Carino, Sustainable Healthcare Manager, for leading the process with a pretty short window to deliver a cohesive and transformative event online. Thank you, staff. We look forward to seeing you again in 2025. We will return to an in-person and online Greening the Healthcare Sector Forum in the last week of October in 2025. Thank you, everyone. Go well.